Welcome to Positive Outcomes, where leaders turn hard-won experience into income, impact, and freedom.
Hello, everyone. You are welcome to Positive Outcome. This podcast is where professionals and leaders come here to change their expertise into income, impact, and freedom. And of course, I'm your host today, Dr. Doreen. So let's talk about today's guest. Today's guest, his name is Kassim, and I don't want to be in trouble by attempting to say his last name or first name. Which one is the first name?
Kassim is my last name, and my first name is Okumemu.
Okumemu. Oh my God, that's a beautiful name. Okumemu Kassim. I deserve a gift for that. Okumemu Kassim. He is a dynamic and disciplined medical affairs program manager at Coloplast, based in a company that is based in Minneapolis, Minnesota. He brings nearly a decade of experience in medical devices, spanning medical affairs, regulatory compliance, quality, and applied clinical research. At Coloplast, Kassim drives medical strategy, evidence generation, regulatory submissions, and global collaboration on women's health therapies. This is extremely impressive. His career includes leadership at Medtronic and Baxter. I know all the healthcare providers. If you don't know Medtronic, since I didn't know Medtronic, but I remember Baxter, right? And Hillrom, with contributions across deep brain stimulation, pelvic health, cardiology, and even more. What an impressive experience. In 2024, listen to this, guys. It keeps going. So if you're listening to this show, if you just started, go ahead and share it to someone that wants to be in this field, in compliance, in medical devices. Just go ahead and share it because they can always learn something. Or follow Kassim. He's on LinkedIn and contact him, right? But listen to this. In 2024, he received the Baxter Worldwide and Regulatory Award for innovation and evidence generation. Did they give you money with that award? And I must add that beyond all of that, listen to this very well. Beyond all of that, Kassim co-founded a company called Twin Vision Home Care, which brings compassionate care directly to the community. You can see his corporate side, you can see his business side. Isn't that amazing? Kassim, you are welcome to Positive Outcomes. We are so excited to have you on the show.
Thank you very much. Thank you for having me on the show. It's been a pleasure, and thank you for the warm welcome. I'm happy to be here to talk to you and to share what I have with your guests.
Wonderful, Kassim. I see that you have worked across several top medical device companies like Medtronic and Baxter and now Coloplast. So please share with us what is one leadership lesson that you have learned in the medical device field that you carry with you up to today.
So I think one of the major piece of lesson that I carry on throughout my journey, but in the medical device space and in the business world, is never stop learning. So learning is key. Always keep learning, even within my team. Working with other cross-functional teams is always important to keep learning because we don't know where we could get some information to continue to improve ourselves. Having this growth mindset that I believe one should have is essential in their career path. Being a leader, investing in other leaders is good to always learn and use your learning to impact others, either if it's delivering project, delivering what you promised to your cross-functional teams is always important. So incorporate learning into your leadership journey and into your mindset.
That's super amazing. He mentioned the growth mindset and never stop learning. And one thing I know as a leader for over 23 years today is leaders are learners. You have to continue to learn because if you're not learning, you're actually going backwards. Okay. So now let's come back to Twin Vision. You also co-founded Twins Vision Home Care Agency. What inspired you to even step into entrepreneurship alongside corporate career? That is so amazing.
So, serving has always been part of my journey. So great leaders are also great servants. Even in the Bible, Jesus was a servant. So if you're a Christian, you should know that. But one of the major aspects is serving the community, serving individuals in healthcare. Although I work in the medical device space, Twins Vision is a community and group home that serve the community across all ages, from young to old. We provide skilled nursing services to individuals both within the group home and in their own homes, within the community home that we have. And my partners and I share that same vision. And one thing about leading is having a shared vision and inspiring that shared vision across the board within the leaders of the company and even among the employees is always important. Those who follow you follow a vision, because having a vision and having them see something they aspire to do every day is vital. It's vital to progress. It's vital to growth. So that is what we work towards, serving our community, serving those individuals who are in need of health, and just to improve their health. As I once learned at a very young age, health is wealth. So it's important to have good health. So we serve individuals around the community, in their own homes and in the community home.
That is super amazing, guys. If you're in the Minneapolis, Minnesota area and you're listening to this podcast and you need someone that needs help, I will run to this kind of a company, because he talks about service. He talks about helping the community. And also he's in the medical field. And you can really, he talks about collaboration, shared vision. If you don't have a vision, like he clearly stated it, where are you going? So this is a company with a vision, and you can see how he's blending both his corporate leadership and he's bringing those skills to Twin Bee Vision as a servant leadership. That is so amazing. That is so amazing. So now, thank you so much for sharing those with us, Kassim. It is clear that you have a passion for both innovation and service, and that's why you find yourself in the medical device field, and then now you have a company. But today, guys, this show is going to be a little bit different. Kassim came to my podcast, Positive Outcome Podcast, to interview me. So you guys put a thumb up and encourage me as I answer these questions, right? So now I'm going to give our guest for tonight the mic so that he can go ahead and ask me some questions, and then we can talk. So Kassim, over to you. Flipping the mic over to you.
Thank you, Dr. Doreen. Thank you very much. I mean, it's a pleasure to come to your podcast and interview you, ask you about your leadership journey. The main purpose of coming here is to share your journey. I don't know how much your listeners know about your leadership journey. You've grown in your career. You've had multiple years of leadership, even being a doctor, having a doctorate degree, being in one of the prestigious hospitals like Johns Hopkins. You've also led in different pharmaceutical device industries. So you've grown in pharmacy, led different teams across the board. So what we are here to learn is your leadership journey. Right.
Okay. I'm so excited. I'm looking for somebody to come to my show and editing me, but I'm ready for that.
I mean, thank you for giving me the mic, for sure. It's a pleasure. I hope I do a good job in terms of bringing out what your listeners want to hear from you.
And I am looking forward to that, Kassim. And really, I'm hoping that the next show you'll be the host. And that's how we leadership, right? Maybe when I'm in Africa someday and I can't make the show, the podcast, I'm going to say, hey, can you host the podcast for me? So this is a learning curve for all of us.
Exactly. So let's start with this. What do you, your leadership journey? So what got you started, and where do you see yourself at right now in your leadership journey?
That's a really good question. Some people, there are two theories of leadership, right? Some people are born, they came to this world as leaders, and then some people come and learn leadership. But I'm one of those that I feel like I came out of my mommy's stomach being in a leadership role for whatever reason. Because growing up, I was always organizing stuff for the kids to come play. I was telling them, you do the ball this way, or you do the baby this way, or you do this way. So I feel like I came just to help people organize and go to the next level and have those positive outcomes. So growing up, it has always been something in my mind. I remember even when my mom was really, really sick, I went to the hospital and I was looking at the nurses, and I kept looking at what can we change? I was looking at the challenges, and as a leader, you're always looking at challenges as an opportunity. As we know, a challenge is a seed to grow. It's a seed of an opportunity. So coming to the state, and I first went to Ahmadu Bello University Medical School, and I wasn't fulfilled because I was not leading, right? So I was thinking, well, I can treat these people, but where can I impact? Where can I change structure? Where can I problem solve? Like I was doing, playing in the field with my family members. So when I came to the state, I got to pharmacy school. I did a lot of research, and I did my PharmD MBA, and I graduated the same year with both of those while being 9 months pregnant. So pressure just motivates me. right? So my journey really as a leader is that I'm always thinking, what is the problem for me to solve? And I feel like I didn't even have to have the title to be a leader. Like I always tell everybody, wherever you find yourself right now in whatever you're doing, you can still lead. And it shows more when you were under pressure. Like I said, I came here, I did from the MBA. I was like, two of us could do both degrees at the same time. I finished my pharmacy school graduation a week later. The next week, I was walking down the aisle with my master's in business. And I was 8.5 months pregnant. But I still did it. So the pressure for me actually helps me to think, how can I make this better? What can I change? Then growing up now, as soon as I got out of pharmacy school, to be honest with you, Kassim, it was really interesting because my first role was a manager at a shock trauma facility. And I didn't even know how to start, right? And that's why I say that leadership is something that you have to wake up and think every day. What is the problem I have to solve? Embrace the challenges. And you have to be intentional to want to be in that role. Because I don't care how much shock trauma had paid me that time. If I was not willing to help, if I was not willing to impact, if I was not willing to motivate, if I was not willing to solve problems or to journey with people, I would have never been fulfilled, right? So that is really much the beginning of my journey. And I'm talking about shock trauma. My son is 22. That's 22 years ago. That was my first role, right? As a manager. And I was how old? 26. So that's my journey. That's how I started to where I am today. And after that, I became a manager, I became a director, I became a senior director of operations, I became a vice president. And my last role was a chief compliance officer.
And that is that is very, very impressive. You mentioned you felt like, or you believe that you were born to become a leader, and you just jumped into it. During the short time I've worked with you, I see that characteristic in you. You always jump in to solve problems. You always jump into solve a situation, even if almost taking responsibility of the situation and finding the root cause.
Right.
What?
And you can see from our conversations, like I
Correct.
said, we have business partnership on the side apart from the show. You can see when I'm listening to ask, have you done that? Can I come in? How can I help? I give recommendation. As leaders, one thing I always do is that and my team members, they just say, don't go to Dr. Doreen's office. If you're coming to me with a problem, you're coming with a possible solution. The solution might not be the right solution because we are working as a team. We are one team with one goal. And the diversity of the team, the ideas of the team, I'm telling you, is so amazing. So when you're working in my office and they're laughing, they'll say, boss lady, this is the problem and this is the solution, because they know that I'm a solution-based thinker. Because if they come with a problem and I immediately give them the solution, I'm not helping them. Right? So you have to trigger that leadership in your team member. You have to trigger them to think what the issue is. So if you come and say, hey, the bulb is not working, or something is not turning on, but I have sent money to get it. Can you reimburse me? I welcome that. Don't just come and say, oh, boss lady, it's crazy. The lights are not coming up. I don't know what to do. Then I'm going to sit down with you. Oh, what do you think? I'm not going to be upset because that's how you can understand it. That's your own style. But your goal as a leader is that person coming to you should leave as a better person, as a better thinker, as a better person to process information and issue, as a better problem solver. So you take that attitude or that energy or that being upset, and by the time they leave, most of them are smiling. Thank you, boss. They used to call me boss lady. I'm like, no, just call me Doreen. Thank you so much. I'm gonna go fix it now. So you see how you change the environment, right? So that's how it works.
Because now you're empowering others to do that. You're empowering others to not just see the problem, but look at possible solutions. So for individuals just starting their careers or trying to become leaders, trying to find their ways in their path, they find themselves in a process leadership position or a people leadership position where they're leading people. How would you say they should find that path to be solution minded? So that is probably two parts of the question. How should they do it? And what made you realize that is how you look at problems, or what instigated that aspect of you to view situations in a solution minded lens?
That's a really great question. I think that before I talk about the process and the leadership, let me talk about the solution based mindset. I think that was just in me. Like I said, even everybody that talks to me right now, what do? I consult leaders. I help people to advance their career. Today, I was just working with someone saying, you're not going to get that job. Your resume looks horrible. Your LinkedIn profile, I will not hire you because this is what I see and this is what the solution is. So I think that was kind of innate in me. One thing I do and I tell people is that leadership starts with you. If you cannot lead yourself, you cannot lead the world. So I hold myself highly accountable. I do a lot of gap analysis on myself. I remediate a lot when it comes to issues of my life. And because I do that so much, so by default, I find myself doing it for everyone around me. So if I hear something, I'm always thinking about the solution. So I don't know if I even learned that in my MBA program. I have a black belt. I'm a Gallup strength finder. I'm a diversity and inclusion coach. I have all those things. But I think that particular aspect of me is just innate. It's just like I said, I was born to solve problems even as I was a baby, right? Yep. And to talk about the other part, about what was the other question again? The leadership and the process. What was the other question?
How do you inspire people or help them find
Their
the aspect in their pathway in terms of being process leadership or people leadership, leading people, leading process?
Right. That is a great question because when I talk to leaders, I do assessments, right? Like I coach leaders to take the next level. For example, if I have you come in as a manager, you really want to be a director in your company, or you're a director, you want to go to a VP role, I will do an assessment. I have a couple of assessments I love to do. I do the Gallup assessment, but I also do the DISC analysis assessment. Those will show me who you really are. And I have leading questions that will tell me who you really are. And then I'll ask you questions that you are not going to be sure or don't know why I'm asking, but it will help me to know how you show up and how you are accountable and how you, if you're teachable and if you look at challenges as opportunities. There's a book I read when I was doing my master's in business administration. That was, oh my God, that was like 25 years ago. But it's called, I think it should be on Amazon or something. It's called Positive Turbulence for a company. Each time there's a turbulence, there's something out of it. So I will bring issues that will really upset you, and then I will see how you will solve it. Based on that, honestly, I'm going to give you my recommendation as to how you as a person show up and what exactly you need to work on. So I use assessments and I use our conversations and I use your problem solving strategy because I believe that every issue you have to strategize, right? For example, you have to have a process in place. You have to have a structure in place. You have to be organized and disciplined as a leader. If I realize that you are missing a lot, then we're going to have a conversation because my goal is to build you to be a better leader where you are delegating but not micromanaging, where you are working alongside your team members, where you're inspiring, where you're coaching and you're teaching. So I put all of that together to kind of help you align your soft skills and your technical skills.
You've done so many great points that I've learned along the way as well. Like managing yourself. I think I learned that from one of the books I read, Being the Boss by Linda Hill. Talked about shared vision as well. I've learned about that. I think that is a good skill to have as a leader, hiring others. There's so many points, and I don't want to know where to start among those. But I would say, first of all, let's talk about your assessments. There's so many assessments out there, different assessments. And I like that you say you will look into the assessments first and ask them difficult questions to see where they should or an individual should focus on or work on. Do you believe individuals should focus on the strengths to continue to improve that? And tell me why. Or they should also work on their weaknesses. But what do you think?
I do think that there should be a balance. I think that a lot of leadership in the leadership world, they said focus on your strength. But I'll tell you this, if you just totally ignore your weaknesses, you can get to a place where you might need to pull something from that weakness that is vital for that role. So you have to create an awareness and be really sure that you're lacking in this specific weakness and have a strategy in case that will come up. For example, if you're lacking in a specific technical skills, like I said, and if you read my book, there was a guy that was on my team, extremely good guy, but he was an introvert, but he worked really, really good. But he was aware that, you know what, I know we talk about teamwork. I know we talk about this. I know all of this, but I have anxiety when I'm in the middle of all. He was a high performance. He worked really well. Productivity was really good, but just don't put him in the group. But he was intentional to tell his group members that I can come, but I would rather just type my. We as leaders, we have to understand people's uniqueness. That's a skill to be able to help them to be successful. We don't have to say you can't work because you're not a people person. You're not a people person, but you have other skills that the person that is a people person doesn't have. So the best part about leadership is understanding their uniqueness. If you look at a puzzle, it's very different. The shapes are all really different. One person is showing up a people person. One person is an introvert. One person is the one that will ask all the questions in the meeting. One person that will come to make you to be a better leader and trigger you to be really upset. One person will come. They all have different talents and skills. But you have to sit down when you're doing your team analysis. As a leader, you have to be able to do a SWOT on them. Their strength, their weaknesses. Even me, I have my own strength, I have my own weaknesses, and I know what to pull. Like some technical things, I have no clue, but I'm quick to say, hey guys, this needs this. At least I'm aware that we need to do this. We need to do, let's say I'm in compliance, and sometimes I'm like, what is vulnerability scanning? I don't do that, but I know it's needed. And I know that I can say I don't do that, and I don't know how to do it, but I can pull resources that will help me to do that. So I know I'm talking too much because it's a field that is really confusing, but I want everyone to understand your strength, know your weaknesses, and know how to overcome your weaknesses. Do not ignore it. Because nowadays, interviewing executive roles in leadership, believe it or not, they want to see how you deal with your weaknesses. If you're able to first be aware of it and how 3 things you can do to help you overcome challenges due to your weaknesses.
That is a very good point. That is a very good point. And I believe that we as a leader should understand that. I agree with you in that aspect. Something that I know that always come up is, as a leader, how can you be vulnerable to share your weaknesses? Because for some individuals, if you share your weaknesses, it's same as you don't have competence. So you lack competence at what you do. How do you differentiate that? Because some school of thought believe one should be vulnerable, but some individuals also find that as lack of competence. So what do you, where do you draw the line? What do you think about that?
I think leadership is you're also a human being, and you should be vulnerable and you should be hard. You have to find balance. Balance is the way you present yourself. The days that my last role, I was working at a company, a home infusion company called Option Care. And I was covering 3 states. I was covering Maryland, Virginia, and DC. I had, my organization was huge. But some days I just say, guys, when I met with my directors, I said, like, what I said did not just make sense. And I wanted to come and tell you guys that we need to re-strategize. And I'm so sorry. I went home last night and I thought about our conversation. I just think that's not going to work. What do you guys think? Let's share your ideas. Let's talk about this. Let me tell you something. Once they realize that you are able to come and say, hey, I made a mistake. Let's put our heads together and fix this. Respect you. They see the integrity. They see the transparency. They see the vulnerability. And they see that you are still able, within that limitation, to work towards the positive outcomes. Nobody's perfect. It's one team with one goal. The issue is when leaders when they make mistakes and they're not owning to it, and then they become the boss. I'm the boss and you're the what? It doesn't work. You will not grow. You will grow just for a while. And when you're falling down, there will be nobody to hold you because you're going up. When you're falling down, somebody needs to be there to hold you. So yes, you should just be you. You should be as transparent. You should have integrity. When you feel like, you made something that requires you, oh, I'm not having a good day today, guys. How are you? In case you come to my office, I'm dealing with this report, or this family member has something. I might be a little bit slow, but I'm going to come out of this, guys. And I'm telling my team, till today, we talk because we developed over 6 years a very, very good relationship. But I want to say that as a leader, you need to know when to be firm, when to be strong. Because if you become vulnerable every day, you're going to be perceived as a very weak person that's always coming there with some issue or something. For me, that will happen like once in 3 months or once in a while. I don't intend for it to happen, but I'm very transparent when it happens. But they know that I have expectations, I have goals, I have one-on-ones, and they know that I'm very strategic with what I expect from my team. So you should have your expectation very, very clear while also being vulnerable. So you have to balance it out somehow.
I think you hit the nail on the head for sure. You did that. You hit it on the head because as a leader, what I believe is although we should have some limitations on how we share and what we share, but it's okay to be vulnerable. It's okay to like tell your team, hey, I'm not having a great day today, but we could still meet our milestones. We could still drive to the goal. I may work with you differently and the differences that could happen in terms of how I interact with you or just ensure that I'm trying to drive to the challenges for the day. However, we're still a team. We still work as a team and always as you said, we're humans. Although we leave home to come to work, we don't shed our personalities. We come as a whole human being. And that also goes into being authentic. And some individuals believe they should be different, have different personality at home, and different personality at work. What would you say about authenticity and how that could
Oh
play?
boy, I think that's a really good question, Kasim. I do think that we should be authentic at home, at work, because we don't want to be liars. We don't want to fake it. We want to be authentic. And of course, if you listen to me, I say leadership begins at home. The way we raise our kids, that's how they're going to be the leaders of tomorrow. So, for example, when I leave my work, I come have 5 kids, I have a husband. So I can't come home and be expecting KPIs and root cause analysis and things like that at home. I would do it, but in a different kind of way because there are expectations, especially for my kids. But being authentic is extremely important in today's leadership because people see through you. And if you're leading and you don't have followers, then you're not leading. The worst thing that can happen for a leader is for people to work for you because they want a paycheck. Because the day that paycheck is gone, they have nothing to do with you. They cannot, they don't want to deal with you. Paycheck is important. Money is really important. But there are 2 things. They have to work with you is it because they want to or is it because they have to? If they have 2 leaders doing the same thing in that same role, making the same money, and there's Kassim and there's John, are they working for you because they want to or because they have to? If they work for a leader because they have to, it's because they just want the money. They don't care. They just come and do this and go back. No engagement, just pay me. But if they come to you, that's because they want to, they are very engaged. You will get to your goals a little bit faster. Your scores will be better. Your customer service will when they work for a leader because they want to, it is extremely more empowering, more engaging. The environment is very, very powerful because they want to, not because they have to. And I challenge any leader hearing me right now to go and sit in front of your team member. Look at them eyeball to eyeball and say, how are you? I want you to be very transparent with me. If you're working the same role, same paycheck, are you working for me because you want to, because you have to? If they're not working for you because I have to, I need to get paid, ask them a follow-up question. What can I change in my approach, in my style that can make you work for me? Not because you have to, but because you want to. Do that and you'll be amazed some of the feedback you will receive and how that will change your leadership style. Leadership is leading. If you're not leading, you're managing people. You want to be making sure that people are following your leadership.
Okay, that is, yeah, I like what you shared. Like asking people if they want or if they're just doing it for the paycheck, basically. But when I think about that concept, it makes me go into other areas that sometimes it could be beyond the leader's hands. Example, working for a big company. As a leader, I could be ensuring that my team are well equipped. I'm trying to teach my team well to ensure that they stay with the company. Where do you draw the lines with how the leader, especially if someone is not the owner of the company, I happen to be a part owner of the business I work for and also work in an industry whereby I don't own it. Where do you draw the line between ensuring that you continue to inspire a team regardless of the rules and regulation or the culture that is in that particular community or company?
That's a really great question. And if you're a leader, you have to understand that you're the bridge between the corporate, the CEOs, the executive, and your team. You're in the middle. You're the middleman, put it that way. And your conversation has to be intentional, not to push the blame. You can tell them that this is what I can do. Unfortunately, I'm going to try to do this, but it's beyond me right now, but I'm working forward to do this. You have to be able to build the trust. They have to really trust you. And when they trust you, they by default understand that certain things are beyond your control. Certain things are beyond what you can offer them. So you are really the bridge. Remember that your role is to get to a positive outcomes, and you're one team with one goal. The worst thing you can do as a leader is to make your executive look bad. Then you're not supposed to be. Then just quit, please, just quit, right? Because you're going to cause a lot of disengagement. You're going to cause an disengagement. So being in a leadership position, let's say director level, is extremely critical that you understand the dynamics of the company and how to blend it when you're talking to your team. For example, I've been in situations where, for example, when I had Option Care and BioScript, the merge, and I had to lay off about 7 to 10 team members. And I kind of personally felt like some of those roles, we could have used them for other things. I fought the battle. I did all I can, but the company did not see it that way. But I won't come back and say, well, I did this. I told the company this and they didn't see it. I can't do that because that is making your team member not to trust the company where you work for, right? So that's where leadership comes in. I had to come and present it in such a way that they're going to get a good severance. I'm not going to say I did this and I did that and make my CEO and my COO look bad. That is not leadership. You are not always right. Your decision can be vetoed, and it's okay because that's your role, right? So you have to be able to bridge it where you maintain engagement with your team member, even when you don't like it. Leadership, you're not always going to like it. Leadership, like I tell people, you have like something in your back that say backstab me, beat me up, talk about me. You have like a placard, like a whole sign behind you. I am the cause, I am the problem. Because people, regardless of how hard you try for you work for your team members, someone is not gonna like you. He's gonna blame you for everything, regardless of what you do. You just have to be intentional to keep giving and doing your best and coaching them and holding them accountable. Why not pointing fingers? You take the ownership and you do what you can do. And that's why there's HR. If it comes to a place where you think that is going beyond your expertise, then you can bring HR in to deal with those things.
So, I mean, having said that, do you think there's a difference between leadership and management?
Of course. Of
So,
course. It's a huge difference.
why I ask that? Because different people have different sort of school of thought, basically, and individuals would say it's interchangeable. Meaning, once and in a culture, United States, like we're here in the United States or in the Western world, where some individuals believe it's mostly generally known that the Western world is an individualist culture, and there's some other parts of the world that is seen to be a collective culture, meaning they are not just thinking about themselves or thinking about the collective nature. And leadership in in those parts of the world could be seen differently. And in a large company or a small company, how you lead could also be different. But also, people could interchange leadership and management within those cultures. It could be seen as, oh, I'm just a manager, I'm leading directions. But in some individuals mean why they lead or why they're in a management position, they think about that as leadership position. Or for you, how do you see it, regardless of the culture one is being leading or being a manager? How do you see the difference?
So I want to say that leadership is not a title. I want to make sure I make that very clear before I say anything. Leadership for sure is not manager of this or director of this, of that. Leadership is a style, it's a personality approach. It's the way you bring people along. Management is not a bad thing. You can be a leader and you're a manager. You can mend it both. But in organization, US based, which is what I'm mostly familiar with, when your title is a manager and your title is a lead, is a director, it's a different expectation. And you can have a title as a manager. Manager meaning that you're into the day-to-day task, meaning that you're at the back, maybe checking compounded prescription. You're more hands-on as a manager. If it comes to organization, the leadership role, the way it is structured, right? So the manager is there, but there are managers that are leaders, managers that they're managing because that's the position that they are in the company, but they are leaders. Like I was a manager before, I was a supervisor, then I became a manager. But while I was a manager, I was leading. And that's why when a director of pharmacy position opened at Mount Washington, my director called me and say, hey, do you want to take this position, please? Because they saw that I had the title of the manager, but I was leading, right? So leadership is not a title. Leadership is not you sitting in your office. A way of mentoring, coaching, pairing, and leadership are both Everything you can hear from me today is influence. Leadership is influence. How you can influence someone to do something to get to a positive outcomes. Not you doing it for themselves, not you micromanaging, but you delegate by yourself, asking, did you do this? Did you do that? Have you been there? Have you done that? Leadership is just influencing them and letting them know that they are able to do it, right? So in the African culture, and honest with you, I'm an African, but I've not really worked there. So I don't know how that happens. But I still think that managers are leaders based on how they show up. You have to do your job description. If you have to be, I had a director of pharmacy. I had a manager, pharmacy manager. I had a pharmacy supervisor in my roles. I had a director of nursing. I had a nurse manager. And then I had a nurse supervisor, scheduler in my roles. But all of them had different job descriptions. But the pharmacy supervisor had leadership skills that maybe the director of pharmacy doesn't have. But the pharmacy supervisor was a pharmacy technician that was not able to have a pharmacy director role, right? So leadership is a skill set to influence people to do something. So if you can influence someone to do something, you are a leader beyond the titles, beyond the office, beyond the names, beyond all of that stuff. So leadership is influence.
I like that. Yeah, that totally makes sense to me because I also believe that title does not equate to leadership because someone could not have a title, but it could influence others, as you mentioned. And you talk about influence, that goes or follows the line of inspiring the shared vision, because when you can influence and inspire a shared vision, you can move or drive your team towards a particular goal, towards a particular aim, what you see that no one else see right now, but you can influence them and speak to them and lead them towards a particular direction. It doesn't necessarily have to be tied to a title. It could be accomplishing a goal or accomplishing a challenge
Amazing.
or
Yeah.
solution-based, as you mentioned earlier. But for you, what have been the difficulties throughout your journey?
Do you really want to hear that?
Yes, I mean you don't have to say everything, but
Oh boy, I don't even know where to start because my journey was very, very tough. And I do believe that every challenge that I have faced has been a seed for a greater opportunity to come forward. So when I finished my family MBA, Shock Trauma Maryland moved me here. They paid for everything. They paid for my apartment. They paid for my moving. They paid for everything. And I was a single mom. But my intelligence was there, but I did not know what leadership was. It was very traumatizing for me walking into a big teaching hospital and being called their manager. They were looking at me like, who do you think you are telling me what to do? Right? It was extremely tough, but like I always say, I found a way to. John Maxwell is my mentor, and he taught us that everybody communicates if you connect. And even before I got my certification as an executive leadership consultant, I said to myself that I am my mother's only child in America. I am a single mom. I need to feed my son. I don't really care what these people say to me and how they insult me. Some of them told me, speak English. I don't know what you're saying. Your accent is so strong. I would drive home crying every single day. My KPIs were extremely low because nobody listened to me. Nobody did what I had to do. But I said I have to connect with these people for them to like me. Because everybody communicates if you connect. You connect before you correct. You connect before you speak. They have to know you connect with you before they connect with whatever you're selling and whatever you're telling them to do. And of course, I prayed. I'm a woman of prayer. I will be crying all the way home and I'll be crying all the way home. But in my mind, I knew that I have to have this job. What am I going to do? I have to pay my mortgage, pay the blah, blah, blah. So I started connecting with my team members. I would say, oh, I understand. How are you? Sometimes you would just say, how are you? And nobody will really answer you. They'll look at you and they just turn and keep working. And I'll just take a deep breath and I'll keep going, can I help you with this? Can I help you with that? And believe it or not, Kassim, knowing and being aware of that challenge, knowing that they're looking at me as an outsider, knowing that they're looking at me like, you don't even qualify to have this position, knowing that, oh, this poor lady, single mom. In fact, where's the father of your child? They ask me questions like that. And believe it or not, he was a well-to-do person in medical school at that point, right? I think he actually finished medical school, but they didn't even know. So I realized that at 27, that I need to prove myself. No fighting. I need to be teachable because that was my first leadership role right out of pharmacy school. But after a whole year, I got an award for my pediatric unit had the best KPIs. Pharmacy, we used to do consultation all done. The energy level, my Gallup score for my team, everything. And that's how I ended up within 2 years came and I became a director of pharmacy, right? Why? Because I took that time to figure out what can I change. And that's just the first thing. Connecting with them, asking them questions. Well, you were not too nice to me. What can I do to make you nice to me? They think I'm joking, but I'm really serious. But it's my approach, the way I communicated with them and had my one-on-one. What will you change? How will you do this? Okay, I understand. Building that rapport, connecting with them, inspiring them. And at one time I had to talk and they were like, wow, can you talk like that? So that I'm saying that if there's a challenge, that is an opportunity for you to grow. When I became a director of pharmacy, I would sit on the table and 3 seats this way, nobody would sit there. 3 seats this way, nobody would sit there. It's like I was thinking, it's like something was wrong with me because I was just different. I was the only female most of the time. I was the only African American. And then I was the only African and I was younger than all the doctors there. Mount Washington, I was leading the PNT. I was the co-chair of the PNT committee. So it was another nightmare until the CEO realized that and started saying, Gwenny, because my first name is Gwenny, come and sit right here. Come and sit right next to me. Because he saw at the beginning that the team members were not comfortable with this strange person around here. But again, I was there for 8 years. At the end of the day, they did not want to let me go because I just knew that I had to build a rapport and learn and learn and learn. But after those 2 experiences, when I got to option care, I didn't even face that because I already knew that I had to connect in my interview. I had to connect day one. I had to set different strategies. I had to approach people a different way. And Baltimore was always number one. My KPI was always number one. So each time there's a challenge, and if I did not handle that challenge like that, John Hopkins would not have called me because Mount Washington is a division of John Hopkins. Hopkins is a big university. In being a director, there is no chicken change, right? So if I did not handle that the way I handled it, I would have never put John Hopkins in my resume. So instead of being upset and pointing fingers, you can do that. But I want to encourage you to look at the challenge as a seed to an opportunity and look at everything you can do to solve that puzzle, to solve that problem, and you will not come out the same person.
That is very powerful. Yeah, that is so powerful. Now, just for the listeners here, connecting with people. We are all emotional human beings, and although we try to analyze different things in a logical way, we also have our beliefs or backgrounds that enable us to carry our workload or work with different people. But what you said is every challenge is a seed or an opportunity for you to grow. Growing in yourself, managing yourself, learning about yourself, and learning about other people, connect to people. Wow, that is very powerful.
Yeah.
Thank you very much, Dr. Jory.
No problem. It was not an easy journey, but I enjoyed every moment of it, and I can live it over and over again because
I don't.
huh?
There's so many things like to talk about. It seems like a journey is great. Your journey, I think, is something that we could all learn from. We could all learn because every time you speak, you drop like a powerful lesson, and you kept saying, learn managing yourself, learn about yourself, learn about other people,
Right.
connecting. Not to take so much of your time. If there was one thing you would share with the listeners, with someone growing in their career, no matter what journey or where they're at in their journey, their leadership journey, what is one piece of advice you would give to them?
I would say it starts with you. It starts with you. Know you, know your blind spots, know when your claws are going to come out. Know what trigger you, lead yourself. We're talking about leadership, so I'm going to focus on that. Because if you cannot lead yourself, you cannot lead your team. If you cannot lead yourself, you cannot lead the world. It starts with you really being self-aware of who you are. I wake up every morning and I ask myself this question, Doreen, who are you? How are you going to show up today? You take a stock of what happened the previous day. Why am I thinking the way I'm thinking? Why did I answer the way I did? Why did I solve this problem the way I did? Because we have a lot of things in our subconscious mind that if we are not intentional to work on our subconscious mind, we will be leading ourselves blindly, thus affecting our performances at work. Work on personal growth, work on personal development, be very, very self-aware, and hold yourself highly accountable for your actions, for your words, for your deeds, for your successes, for your failures, for everything that happened. If you can really be your best competitor, if you can be your best critique, I'm telling you, by default, there'll be less work you have to do to lead. It will just flow naturally. Because sometimes performance and turnover rates are high because leaderships, they don't know when their claws are going to come out. They don't know when they're going to be triggered. Understanding when you're triggered and knowing that and writing them down and say, this would trigger me, walk out for a minute, take a fresh air. Don't respond right now. Walk out and come back and reply to that email. It's going to change a lot for you when you understand you and understand how you answer, especially during trying times, pivotal moments in your life. So it starts with you.
Thank you. Thank you very much. Thank you for sharing that. Thank you for this advice. I think it's something I will also take from and learn from, and your journey is very powerful. Thank you very much, Dr. Doreen.
Oh, no
The
problem.
listeners, think we should all really listen to this. There's so many different lessons that you poured in. It start with you. It's something that I think myself and other people would carry on, because as we develop ourselves, we'll continue to develop others, continue to learn about others. Thank you very much. I'm glad that you shared your journey to other people with the listeners, and I'm glad to learn from you.
No, thank you so much, Kassim. This was amazing because I've not really been on the other side for a long time. I'm the one, I don't even know what I
Yes,
said, but
yes.
I'm the one always
Well,
interviewing people and talking to people on the show. But this is really good. As you can see, I'm extremely passionate about leadership. And I always say a couple of stuff, have a toolbox. A toolbox can be in your brain. A toolbox can be in your computer. A toolbox can be something that you have some kind of a structure to solve specific issues. Always do a root cause analysis. Do not move too fast. Take a root cause analysis. Do not push things under the table because they are going to reemerge. And when they come back, it might be really bad for the organization that you're leading. So you want to sit with whatever happened and make sure that you get to the root cause of it. You work on it, you handle it so that you can prevent reoccurrence, right? Because if you don't go through it and know the lesson learned and figure it out and put structure in place and change your policies, make sure that people review it, then you're just pushing the thing under the table and it's going to come out a little bit harder. So have those policies in place, practicalize it, follow the process, do not cut corners, right? Because everything rises and falls on leadership. If your team is failing, you're failing. If your team is not performing, you have to look at your communications. Are you connecting? Are you engaging? Are you really coaching them to be a better version of themselves than the way they came to meet you? That is what leadership is. Leadership is making people to take a next level to grow in their profession and their career. So it's such an amazing and rewarding journey when you do it and you do it right with a lot of love. You're being authentic. You're correcting them in the right way. You're not traumatizing, because I have personally worked in a company where I was very traumatized at some point. So you don't want people to come to work feeling anxious, having a very hostile work environment. That still happens with leadership and all the titles that we talk about. Try as much as possible to talk to your team on the team dynamics and how you're being perceived, and be ready to have those tough conversations so you can look within yourself in the morning and try to change. Okay. And if you do that, you will absolutely enjoy your role as a leader. And I cannot tell you how many people through my leadership are now directors or VPs just because of our interaction.
I was thinking about, you ask your team to give you feedback.
Oh, yes. I think that has to be very professional. Asking your team, asking your team to give you feedback as to how you're doing and what they can change, or have a suggestion box somewhere in there. Because some of them are scared of you. They don't want to come and say, you doing this or you doing this. So have a suggestion box over there where they can type it and put it there, and you take it and you read it, and it's anonymous so nobody feels like it's them and things like that.
Thank you very much. I think before we give you the mic back, hey listeners, I'm giving the mic to the podcast host.
Thank you guys so much for listening, guys. Please.
Thanks for listening to Positive Outcomes. Follow the show and share this episode to inspire someone's next chapter.